The C-section rate in the United States, as I talk about in my book, Cut It Out, is often blamed on physicians or mothers. The blame for mothers is that women want C-sections. Sometimes some of you may have heard of the too posh to push argument, the idea that particularly upper middle class women don't want to push babies out because it's hard to do. And that's been very much debunked by research. It's also blamed on physicians and the idea that physicians just want a convenient birth that they can time. I don't find that either of these explanations hold much water. What I find in my research through interviewing care providers, obstetricians, family physicians, certified nurse midwives, as well as labor and delivery nurses, is that hospitals have been put under increasing competitive pressures since the 1980s. We see consolidation of the healthcare industry. We see the growth of large practices for physicians, and that's a lot due to some changes in Medicare compensation, and this has been written about in the literature. So there are really profit pressures in the healthcare industry in general. With those structural changes, the other thing we see is that the malpractice insurance environment has really changed for physicians. Malpractice insurance is something that physicians have in case of a medical error to compensate the patients. The insurance rates for those medical malpractice policies has increased substantially in the last 2 decades, particularly in the last decade, such that physicians, obstetricians in particular, are often paying over $100,000 a year for their medical malpractice. That has really changed things for physicians. And when you have profit pressures also changing, what happens is that hospitals put in place standardized protocols that must be followed to eliminate malpractice risks. That's a risk they can try to eliminate. So when you have this emphasis on this environment, increasing rates, increasing large multi-million-dollar lawsuits, not an increased rate of being sued, that hasn't changed over time, but enough things have changed that hospitals and also obstetrical practices really put very standardized care for women in place. Things that they do things so that they're less likely to be sued, and the answer for many of them has become surgical birth, that they're unlikely to be sued if a C-section is done. So lots of things feed into this, leading to C-sections, but ultimately it's this idea that C-sections are safe, not safe health-wise, right, but they're safer for physicians and hospitals in terms of their risk of being sued.